a broader perspective. Public Affairs segment, giving the masses a grasp of informative, educative, and entertaining updates on current issues while guiding them to follow the latest development in the society. Beam TV, a broader perspective.
You're welcome to Public Affairs segment on Beam TV. Today we have a very serious issue we want to talk about. A lot of people don't believe it is real. A lot of people say, it's a fairy tale. Some people will say, is it not something that they used to get money from government, that there's nothing like HIV and AIDS? But we want to talk about it. The topic of our concentration today is how to relate with HIV and AIDS infected person. Some people that believe that there's AIDS, when they get to know that this person is infected, they tend to shun the person, they tend to stigmatize the person and then avoid the person. Even if it is your father, even if it is your mother, even if it is your closest relative, your husband or your wife, the person you sleep together on bed, how should you treat this person if this person is infected with this virus? This will be the topic of our discussion today. But before we invite the director and also the project manager of Akwa Ibom Agency for the Control of AIDS, we want to go to the field and ask people, let us know, do people really believe that there's HIV and AIDS? We'll be right back.
Over the years, we've been seeing people with HIV and AIDS, maybe in the hospital or maybe in the churches. You hear people giving testimonies about how God healed them and so on and so forth.
HIV and AIDS is really real and it's really existing now.
I've seen people that live with HIV and AIDS.
I believe very well there is HIV and AIDS.
Doctors here every day are complaining. In fact, even myself, I know it's very, very real.
Of course it exists. Okay, in the Bible they say that diseases that do not have cure will occur. And so that's one of the diseases.
It's real. HIV is a virus. This virus exists when the immune system is being weakened.
Personally, I don't discriminate anybody that is living with HIV. I encourage anyone that is living with HIV and AIDS to take these pills consistently and feel good.
They really need our time. They really need our closeness, that love. You don't need to run away from them. No. You really have to just give them words of encouragement. There is still hope for them.
Well, I wouldn't avoid the person. I have some clients of mine that are positive. I relate with them normally because it has no negative effect on.
I won't send an HIV patient away because he or she is infected. But rather, I'll draw the person very close to myself. We don't contact HIV and AIDS by, hugging somebody or, playing with the person. But I'll get the person very close to myself, take good care of that person, if necessary, buy the person the necessary drugs, okay? So it doesn't mean because he or she is infected, I have to send her away from me. No, it's very wrong, it's very wrong.
I relate very well because he's a human being. Must have been an error that occurred somewhere in the life of that person. Or somehow HIV could be spiritually brought to a person without somebody contacting it through sexual devices or something.
You don't treat them as if they are outcasts, but you bring them to yourself. For example, a friend of yours, your close friend, might have HIV, and on your own knowledge you came on and realized that he has HIV. Instead of you drawing him closer, talking to him, making him feel the love, and you turn back to reject him. To me, if I were to be the one, I'll feel neglected. Two, I would think that no one in the society needs me anymore. And with this understanding, a person can commit suicide.
We tend to run away from them, but absolutely it's not supposed to be so. When someone has an HIV, does not mean that we should not eat with them. it does not mean that we should run away from them. It just make them feel comfortable. But the only thing you have to do is abstinence, to abstain from any sexual intercourse with them in order to avoid yourself being infected by the virus.
Beam TV, a broader perspective.
Welcome back. This is still Public Affairs segment on Beam TV, and my name is Blessing Ambrose. I believe I don't know which direction or which side you are going to take. Whether you're going to take that there's no HIV or you're going to take that there's HIV and AIDS. But not to worry. We'll have an authority in that area, somebody that is going to tell us, is Akwa Ibom State, from the statistics, the current statistics, they say that Akwa Ibom State has the highest number of HIV and AIDS prevalence in the whole of Nigeria. I don't know how true it is, but he's going to tell us. And what government is doing to prevent this, to prevent the spread of HIV and AIDS in the state. And also how to relate with people that are infected with this virus. So let's enjoy the ride. We have a guest in the studio today, Dr. Nkeruem Etuk. He is the director and also the project manager of Akwa Ibom State Agency for the Control of AIDS. Welcome, Doctor, to the program.
I am very privileged to be here. Thank you very much.
All right. You're the director and also the project manager of Akwa Ibom State Agency for the Control of AIDS. Before we go into the discourse of today, I want us to talk about this agency. What do you do? What's the objective? And how is your mode of operations?
Yeah, that would take a whole long length of time, but briefly, what the agency does is that it coordinates all HIV interventions, all HIV programs in the states. It coordinates, whether it's from government institutions or from private institutions, whoever has anything to do with HIV, it comes under the Agency for the Control of AIDS. We don't only control their activities, we also monitor their expenditures to make sure that funds are spent the way they were prescribed to be spent.
Okay. All right. The current research shows that, shows on the statistics of AIDS in Nigeria, shows that Akwa Ibom State has the highest number of people living with HIV and AIDS. What's your own take on this?
Number one, it is not true that HIV prevalence, the number of people with HIV has increased in Akwa Ibom. Okay. Rather, that result got us to know that HIV has reduced in Akwa Ibom. Okay. Because like we have said in many other fora, HIV prevalence in Akwa Ibom State used to be 10.9%. Okay. As at 2014, it used to be 10.9%. But by that survey of 2018, the prevalence became 5.5%. By the time we were 10.9, we were second next to Benue State. By the time we dropped to 5.5. More than 50% decline. That's a good one. We have done, we can applaud ourselves for that. We got to from 10.9 to 5.5, 50% reduction. However, at that point, Benue State, that used to be number one, had a decline of more than 50%. Okay. From about 15% they became 5.3, and we became 5.5. So, by mere placement, we became number one. But HIV prevalence has reduced for about 50% in Akwa Ibom. And of course, even at that we are the highest prevalence, it does not mean that we have the highest number of people living with HIV. We have some other states, without naming states, because of what we may mention in the course of this interview, stigma. Because of stigma, we will not start naming states. But I can say that Akwa Ibom State has an estimated number of people living with HIV. That's about 180,000 people. Okay. But there are states that have up to 300,000 people. But their prevalence is lower than our own. Because prevalence is different from incidence. If we have time, maybe we'll go into that. But the number of people living with HIV
in Akwa Ibom is far lower in Akwa Ibom than in many other states of the Federation.
Okay. All right. What's your organization doing to sensitize the public on the on how to prevent HIV and AIDS?
As a state, we have done a lot. I have said this severally. Equally, if you come to my office, I invite you. I'm not asking you to come and take any gift anyway. Just come. If you come to my office, you see an award standing on my table. That award was given to us. We got that award from the House of Representatives in 2015. We were we were the best states with highest impact of enlightenment on the rural communities in the South. We came up top #1, and we won that award from the House of Representatives, all among all the 6 states of the South. So we would say that that is a testimony to the fact that government is working on getting people to know. However, it must be continuous. We are still doing some house-to-house enlightenment. We are still doing some community testing. Many of the people would testify to the fact that on the plaza, Ibom Plaza, once in a while you see people there doing testing. During the World AIDS Day in the Christmas village, we had a 31-day stand for HIV testing throughout those 31 days that the village was running. We were there. We even carried our own World AIDS Day. We marked this last year's World AIDS Day at the Christmas village. These are all things to help us get to the public. And we at the moment, together with some partners, FHI in particular, we have what we call community HIV AIDS team, that we are taking the intervention to the communities. We stay in the communities. We have teams virtually living in the communities and enlightening and testing people on HIV. I will also use this medium to commend some media houses in Akwa Ibom State. Beam TV in particular, I think I told you when I came here, you virtually came out fishing me. You looked for me and brought me here. So it means you are passionate about this. So we commend Beam TV. What I'm saying is that many of the times we appear on air like this, it is not on a fee. It's just the media houses saying we want to contribute. So I commend the media houses for this.
Okay. All right. So during your sensitization, what's the impact you have created in the society?
Yeah, the impact is that we have, as I speak, the number of people we have tested for HIV has increased. We don't just do tests and the person go. That's what we call test and receive results. In 1 year, we were able to hit a 1 million number of people tested and receive results in Akwa Ibom State. Okay. That's a good one for a state that has a population of about 6-point-something million. And we could test more than 1 million people in 1 year. So that means we have increased our impact on the society. And also, as we speak, if we have time to go into that, we will get to know that there is this project that is going on, using HIV treatments as a prevention for the people who do not have HIV. And what we have discovered is that in the present project we are doing in Akwa Ibom State with FHI 360, the number of people that we have placed on drug has reached about 95% of the people we have tested. I wish I could make this more practicable for you to understand. Before now, Akwa Ibom State was lingering below 30%. We look at who are the people that need treatment. What proportion of the people that need treatment have been placed on this treatment? And we were just about less than 30%. But we start what we call SURGE,
that we are now taking teams of medical doctors, medical laboratory scientists, nurses, community mobilizers. We take them to the community. Every community in Akwa Ibom now has this team. So we take them to the communities, and we have come to discover that of all the people that have been tested within this period, over 95% have been placed on treatment. For me, as a programmer, I am excited, because it means that if we can keep them on drugs as they are at the moment, we are sure that this 95% of the people can no longer transmit the virus to any other person.
There's this fear that people have, especially from this climb. People that are not really exposed to this virus and how to handle it in case you know about the person that is infected. How do you relate? How do you live with someone that is infected?
You live a normal life. The fact that there are rules, don't share showers, don't have unprotected sex, don't, if you are a wife and you are pregnant, go for antenatal and get what we call the prevention of mother-to-child transmission regimen. A woman that has the virus and then is pregnant, there is a regimen, there is a combination we give her, and the person will not have, the baby will not have this. So all these have been stipulated. And then once you do it, once you abide by it, you can live comfortably with the person. The person that is infected is the one carrying the virus. The person that is affected is the one that has something to do. Maybe it's your brother, it's your sister, it's your, you are now affected. So you learn to live with this person, and you learn to be useful to the person. That's the most important thing.
What's the state government doing in order to prevent the prevalence of HIV and AIDS?
State government has done a lot. Like I said previously, everywhere you turn in this town and all the local government areas, you would at one point or the other see somebody doing HIV tests. Free.
Okay. Courtesy of the state government.
Courtesy of government. We also have, in collaboration with the Family Health International, FHI 360, the state government is doing what we call the surge, which is just the normal English word surge. We are surging against the prevalence. We want to crush it. So in every community of Akwa Ibom State now, you'll find the surge team made up of medical doctors, medical laboratory scientists, nurses, pharmacists, community mobilizers. Okay. They are there. And I also will want to crown it with saying that there is what we call, what the program, the intervention calls ownership. The international community wants the local communities, want the government of every nation to own the intervention, fund it, do what you can to. So Akwa Ibom State government embraced it, and Akwa Ibom State government, to the best of my knowledge, is about the only one, if not at least is one of the few states that can say a state government has bought antiretroviral drugs for his patients. That was done in 2018, and the government is trying to do it at a systematic, consistent, like the presidency is doing. The president makes sure that every year a certain number of people are added to the existing one that are placed on. That's what Akwa Ibom State government wishes to do. We have started it, and we hope to continue doing that. So a lot of things that have been done, but we want to say to the public, government cannot do it all alone. There is what we call domestic resource mobilization. We want every institution, organization to do what the media houses are doing. We are not asking for your money. We are just asking for you to contribute one thing, whatever is convenient to you. We need to talk to school children, and you are good. Come, let us enlighten you on key things to say and carry you to schools to speak to the children at no cost.
All right, I wanted to ask of your advocacy. You've narrated your advocacy.
Yeah. So those are the things that we can say government has done. But so much have been done already. Like we have affected the people living with HIV. We have affected orphans and vulnerable children. We have also mobilized people, the caregivers of the orphans and vulnerable children. Many of them have been given a vocation because, you know, picking an orphan, a child that had been orphaned by HIV, you need to feed the child and possibly send to school. So we have this as a part of the things we are doing as a government, sometimes through the international partners, that these children are taken care of by training the caregiver, so that the caregiver will now have a means of livelihood. We are doing some things just like other states are doing.
All right. Thank you very much, Dr. Nkerewem Eto, for making our time to be with us today. And I believe you've heard so much. If you know someone that is affected with, that is infected with the virus, please don't discriminate the person. Don't stigmatize the person. You would have been the one. Who knows? It's not how careful that we are. There are times things happen to the right people, not that they deserve it, but circumstances happen to everybody. So thank you so much for being part of today's edition of Public Affairs segment. And I believe from what he has said, every hand should be on deck. Everybody. If you know how to talk, if you know you can talk convincingly, if you know you can publicize, please do well to reach out to Akwa Ibom State Agency for Control of AIDS. And they'll carry you along, because we need to control the prevalence of AIDS in Akwa Ibom State. Until next week, where we are going to bring you another edition of Public Affairs, still on Beam TV. My name is Blessing Ambrose.
Beam TV, a broader perspective.